Yes, anybody out there that's listening, I am calling healthcare a commodity. Sorry,
Yeah.
not
Yeah.
sorry. I believe if we treat it like that, the patients get better service at a lower price and better quality. Period.
And I will say that's been a mind shift for me because, should healthcare be bought and sold like a Ford, Chevy, or Dodge? For a good part of my career, I said no. But at this point in my career, I'm leaning towards it's different than selling the Ford, Chevy, and Dodge because the sales pitch is different, right? Ram tough, like a rock. Have you driven a Ford lately, right?
Right.
But in healthcare, buy this or be unhealthy, buy this or be financially not well for the rest of your life, or buy this or you die. It's a different sales pitch, right? So we do have to respect that as healthcare
Absolutely.
professionals, and if we do, then I think putting it out there on the market as I'm doing with my business and saying, I'm interested, I want to help you, and I think I have something that can very much benefit you better than the guy down the street or the clinic down the street.
Right. And
So,
consumers decide that.
Absolutely. And that's the key. That's the key. Absolutely.
So I got to tell you, I wrestled with it at first too. And of course, we've been a cash only pharmacy for almost 20 years now. Now, it took me a few years to understand that, yeah, I'm okay competing in a free market. I'm okay saying it's a commodity. I'm okay competing on price, service, and quality. I'm okay doing that. Here's one of the analogies I use, Brian, is that I compare it to food, because without food, we'll die, right?
Yep.
Just like without healthcare, we'll die.
Sure.
And here's the thing. We decide what kind of food we eat. Is the food good for us? Is it nutritious? Is it expensive? Is it going to help us live longer? Healthcare is kind of the same, right?
Sure, absolutely. Yeah.
So it's a little bit different than the analogy of the Ford, Chevy, and Dodge, because we could live without a car. We can't live without food. So that's why I like to compare it to food. And in a free market, everybody wins. We do not, in our traditional model of healthcare, we do not have a free market. We have a network of providers that are credentialed by an insurance company, and the patients are basically told where to go. That's called a monopoly or an oligopoly at best.
Mm-hmm.
And when the patients don't have choice, that means the person delivering the care doesn't have to give good care, period. Tell me I'm wrong, Brian.
No, I can't. I can't tell you you're wrong. I cannot. Yeah,